What's going on, everybody? My name is Will Koopal. I do functional medicine here at the Medicine Man's Corner. I'm here with my patient and friend, Richard Shepard, and he's going to talk a little bit about his journey.
Okay. So, just to keep it kind of quick, about a year or so ago, I was starting to have problems sleeping. It worsened to full-blown insomnia, going sometimes 2 nights in a row without ever falling asleep.
Ooh.
And so, in addition to that, I was having other symptoms like joint pain. I was really stiff. Some days it was hard to walk properly. My face was tingling and hot. Of course, brain fog from not sleeping. And so I went to the doctor a few times, and they would prescribe different sleep medications, but none of it would help. And so I knew I needed to just go a different route. I got to go try to find somebody else that can help me figure out what's going on.
And how long did all this go on, where you weren't sleeping and feeling bad? And was this like years or months?
I would say it started probably 1 to 2, about a year and a half ago or so, but it just got progressively worse.
Yeah, and sleep is super important. That's why I tell all of my patients, if we can't get you to sleep, it's hard to get you better.
Mm-hmm.
So that's really what brought you in here. You just couldn't sleep.
That was the main thing.
Yeah. And then the initial interview, when patients come in, we spend 90 minutes. Me and Richard sat down, and I asked him a bunch of questions. Before he even came in, I send intake paperwork, so I basically got a good story or a good idea of what's going on before he comes in. And then when patients come in, we sit down and talk for 90 minutes. So I basically had a good idea of what was going on with you before we talked. Most patients with Chronic Inflammatory Response Syndrome, CIRS, which is what I'm treating Richard for, they'll answer yes to a bunch of the symptom questionnaires. Like Richard was saying, he was having insomnia, so a lot of brain inflammation. A lot of people have depression, anxiety, just brain symptoms. And then because it's chronic inflammation of the whole body, you'll have inflammatory symptoms throughout. So muscle pain, aches, joints. Some people have heart problems, belly issues, and the list kind of goes on and on. So if I have a patient who comes in with lots of symptoms, I'm thinking CIRS or some type of infection such as Lyme, tick, co-infections, or like a reactivated virus. So yeah, Richard came in. We got him going on the CIRS protocol. So let's talk a little bit about that. What's your experience been on the protocol?
Well, the protocol involves addressing your external environment and your internal environment. So we had to figure out what was triggering the inflammation. And turns out for me it was mold. There was mold in my air conditioning system. There's also mold under the house. So you have to take steps to remediate your external environment. I was somewhat lucky where I found it fairly quickly. I found the issue, but it's different for every patient. But once I was able to do that and take the various medicines and supplements that Will prescribed, I started sleeping better fairly soon. It wasn't back to just regular 8 hours of sleep, but anything was an improvement. And the more I took what he was prescribing, the better I would get. And now I would say I'm about 80% better.
Let's go.
I can more easily tell now when I am around mold because my face again will start tingling and get real hot. But for the most part, I'm feeling much better, able to function normal again, and so yeah.
Yeah, and that's very common for people with CIRS to say is once they get better, they can easily pick up on moldy environments. So just a couple things, backing up a little bit, how to diagnose CIRS and why people even develop CIRS. So CIRS is a 3-part diagnosis. The first part is the symptoms, all of those systemic symptoms. So if you're having symptoms throughout your body that no one can figure it out, it could be CIRS. The second part is a visual contrast study, which was actually developed by the United States Air Force. It's a simple test you can do on your computer, which basically shows the blood flow to your optic nerve or your eye. If you fail that, that gives us insight as to you may be having brain inflammation. So you've got the symptoms questionnaire, which is a simple questionnaire, the visual contrast study, and then the labs. So I usually draw the labs at your first appointment. And one of those labs is the HLA lab. That has to do with who does and who does not develop CIRS. So most of my CIRS patients, they have families that live with them in their home, and some of their family members are not sick. Is that true with you?
Right. Nobody else was affected.
Right.
In my house.
Yeah. So according to Dr. Shoemaker and all the CIRS gurus, 25% of the human population has an abnormal genetic susceptibility to developing chronic inflammation. If you breathe in mold spores or other things, it can trigger chronic systemic inflammation. So that's why Richard had it, but his family doesn't. And I see that over and over again. So that's basically how you diagnose it. And then the treatment is the first and very most important step is remediation, which you've been through. What are you on your second or third round of remediation?
You mean my
home
house?
remediation? Yeah.
Oh, well, I cleaned out the ductwork, fixed the rest of the air conditioning system. Speedy Response out of Tifton, they deal in all that, and they help me out. Underneath the house, had to address all that, put in a dehumidifier, clean the mold underneath, take out all the carpet, replace it with wood or whatever else. Things like the highest quality air filter that your air conditioning system can handle. You need to get those. Getting a dehumidifier for your house. It's amazing how much water is pulled out of the air just to get from a relative humidity from close to 60% down to below 45. I mean, it pulls,
especially around here. I mean, the humidity in South Georgia is crazy.
I dump over a gallon of water every day that's pulled out of the air, and that obviously makes a big difference. So.
Yeah, I mean, even the CDC states 50% of homes are water damaged. I would assume much more than that here in South Georgia with the humidity. Mm-hmm. So, I mean, and kudos to Richard for doing the remediation. I mean, this is not an easy protocol to follow at all, but I think it gives people answers. You know, if you're not getting answers from the traditional route, then give me a call. Let's at least investigate. And I'm not saying it is CIRS. There's lots of other things it can be, which I'm trained to identify. But if it is CIRS, you've got to remediate. That is of utmost importance to get into a clean living environment. So, yeah, that is step one, remediation. The second step is getting on binders and fish oils. Basically, what those are going to do is going to catch the toxin at the liver, and then you're going to basically take it to the toilet. So keeping a healthy daily bowel movement is key during this protocol to get rid of those toxins. And then we're also going to put you on high-dose fish oils at this time to quell the inflammation. And then the third step is getting rid of a bug in your nasal passages. Luckily, Richard didn't have that. And then next, the last step is getting on VIP, vasointestinal polypeptide. It is a nasal peptide. You spray up your nose that basically resets your melanocyte stimulating hormone, which regulates a lot of other things downstream. So ultimately, that is the goal, is to get you on the VIP. We haven't quite got there with Richard because there's some things we have to do before that, which we're still, what are we working on with you? We're still working on the home test, the hurts me.
Right.
Yeah.
Still cleaning. You just have to clean. You have to become a clean freak. And so there's still a lot of the dust that was there from before. And so you pretty much have to touch every square inch of your house.
Yes.
to make sure that it's clean. You don't have to do that all the time, but at least one time. So I'm still going through that process, trying to pass the home test. So.
Yeah, and if you want to start there, I'll put the link below for a home test. It's called an ERMI. It'll basically look at the mold in your home. That's a good place to start. If you're having all these symptoms, do the symptom questionnaire, do a visual contrast, do the ERMI on your home, and then if you want me to walk you through the protocol, make an appointment. Anything else you can think of that we left out before we wrap up?
You have to be committed. You have to put in a lot of work yourself. It's not like going to the doctor and then prescribing you a pill and then that's about all you do. You have to take the steps and be willing to spend the money sometimes. Depending on what your problem might be in your house, it might not be cheap to fix. But if you feel bad enough, you'll do whatever you have to do.
Yeah.
I felt bad enough, and I didn't care how much money it took. If I had it, I was going to spend it to try to make myself feel better.
Yeah, and usually what I see is people who have CIRS, they go to specialist to specialist to specialist and never get the answers that they really need. And that's because this is a systemic problem, right? The human body is multiple systems, but they're all interconnected. And that is what this protocol does a beautiful job of explaining. So if any of you out there having systemic symptoms, you can't get to the root cause from traditional medical paradigm, give me a call, shoot me a message. I'd love to chat, and we'll get you feeling better. I mean, 80% better, you're sleeping better.
Yes.
I'll take that as a win. And I think if you would have continued traditional medical route, you'd have been lots of specialists, lots of meds.
There's no telling where I would be because I was deteriorating so much that I don't know. I'm lucky I came across this. I can say that.
Same. So yeah, y'all reach out to me if y'all have any questions. Thank you.